Welcome to this first event in a series of webinars on shaping the post-COVID world. This is part of a larger project initiated by the Vice-Chancellor's Office, by Professor Chilitsi Mawala. The idea is to look past the current turmoil and ask what comes next. The future isn't always easy to see, but sometimes it is. The COVID-19 pandemic has demonstrated just how surprised we humans can be by unsurprising events. In 2016, the World Health Organization called for the world to be better prepared in the wake of another coronavirus pandemic that's generally known as SARS. In 2014, the then President of the United States, Barack Obama, appealed to the certainty of a future pandemic while he was arguing for universal health care in America. So it's fun to pretend that the current situation is unprecedented, and it's useful for leaders to say that nobody could have predicted it. But in fact, they could, and they did. So the first lesson of COVID then is to think about the future more, especially those bits of it that we really do have a pretty good grasp on, if only we think about it, as well as trying to make some progress with those that we don't. This series of webinars and the larger project of which this is a part makes a start on the biggest post-COVID task of all, learning to think better about the future. It's brought to you by the Institute for the Future of Knowledge at the University of Johannesburg, in partnership with the Library and Information Centre and the Johannesburg Institute for Advanced Studies. Before we begin tonight's session, I want to thank those partners, as well as Mr. Anthony Casaboni, Dr. Oluwaseun Teller, Mr. Ian Least QC of Millennium Chambers London, and of course the panellists who have made time to join us. This event was to have been hosted by the Vice-Chancellor, Professor Chilitsi Mawala, but I'm afraid, unfortunately, due to a personal emergency, he won't be able to attend. He sends his apologies and he'll watch the event when it's posted online, he's promised me. Tonight, we'll be looking at a broad range of issues that the post-COVID world will face. We'll consider the perspective of the developing world as the world enters what looks to be a major economic storm, and perhaps a social and political storm as well. We'll think about how the pandemic might end, or if it will, and whether there are any lessons to be learned for epidemiology itself as well as for the healthcare systems worldwide. And we'll consider what higher education might look like in this strange new world, not least for healthcare disciplines which do not lend themselves to online learning. My first guest is Her Excellency Dr. Joyce Banda, former President of Malawi and long-standing activist for human rights, especially the rights of women and children in the developing world. And it's a huge privilege, Dr. Banda, to have you with us tonight. So we've seen a patchwork of measures across Africa. We've seen stringent lockdowns like in South Africa. We've seen reluctance on part of leadership to lock down in case of Tanzania. And in some cases, we've seen attempts to lock down being resisted by the populace, as in Malawi, where the courts, in fact, awarded an injunction to prevent the government from locking down. So I wonder if I can just start by asking you quite bluntly, do you think lockdown in Africa has worked?
Yeah, these are my views. I feel that it is all about leadership. It is about how a country feels they can fight coronavirus, looking at the opportunities, facilities, and the capacity they have to fight it. I say this because there are some countries like South Africa. Yesterday, a poll revealed that 87% of South Africans are very happy about the way President Ramaphosa has tackled the fight against coronavirus, and especially the shutdown. But you can also see why. Because it is a president and a nation, a president that engaged the nation, engage the people, the citizens. They knew what to expect, what was going on. Testing was done. Facilities were provided. Food was provided even to homeless people. That is South Africa. But if you go from there and you go to Ethiopia, I was just speaking to them today. There's no shutdown, but they have ensured that they have restricted having social gatherings. They test everybody coming into the country. They provide a lot of education to the people. When you look at their rate of people that are infected, it's only 200 something. And the people that have died are 5. So you come to a place like Malawi. It is not by wish that the civil society went to court. But sometimes what is important is, as I said earlier, it's about leadership. If the leadership appears transparent and accountable, and the people know exactly why leaders are taking such actions, the people shall respond positively. But here is a country where 15% of the people are rural-based and 15% living in poverty. So hand to mouth. They spend the day in the market, they buy food for that day in the market. The next day they're back in the market. To them, they cannot imagine shutdown. So the day it was announced here, everybody was on the street protesting. For them, we would rather die than to go without food. We would rather die than to lose our businesses. So to respond to your question, I feel that shutdowns have worked in countries depending on the leadership and how the people were engaged and the opportunities that were provided. What just surprises me is that when you look at the figures of those infected and those dead, there's not much difference. That is, so the question I will ask maybe our experts on this panel is maybe to start looking at how did that happen. But for me, yes and no. But the key is leadership. Leadership that engages the people and does what is right for that particular nation. And so there's no one size fits all. Africa is 54 countries, and each country shall come up with its own modality of fighting coronavirus.
Yes, that's interesting. I think the point you make about the measures that countries take not necessarily being correlated too strongly with the outcomes they've seen is something that we'll discuss a bit more later. A number of people have remarked on that. So I see the point you're making, that there needs to be a different set of responses depending on the context. I wonder then if you can tell us, I mean, it may be sort of obvious, what the effects are likely to be on African economies of this kind of a measure, which I think has probably been fairly, the template has been fairly universal, I think, even if people have followed it to a greater or lesser degree. What do you think the effects are going to be on African economies?
I truly believe that Africa has benefited from having this pandemic getting into Africa later than the other countries in the West, because we were able to observe and see how their economies were affected. And you can see now that before it clears completely, they're nervous about shutdowns and they're finding ways of exiting those shutdowns. So what I see in the countries in Africa, where, like in my country, over 40% of the people live in poverty, there is no way the shutdowns are going to help those countries that have been closed down for 2 months, for 3 months. To come back and build the economy again, it will take a long, long time. And in a place like Malawi, what I see happening is that if there was a lockdown and people didn't do their business, businesses will be closed. For example, in my case, my businesses in Malawi, I run schools. So schools and the clubs and the social places have been closed. And so our teachers cannot be paid because they are paid from school fees. That kind of hardships in other countries in the West, we were told that Britain is paying those that are providing social services. They're paying their staff so that the staff don't suffer. In Africa, people are going to suffer, and I don't know for how long it will take. This, and tragically, Africa was a continent where the fastest growing economies in the world existed. But now we will have to go back and start all over again. So I feel that children will be more malnourished, there will not be enough food, people will not produce, children will not go to school, and businesses will close, and poverty will rise again. Hunger will get worse.
I think it seems like that's probably going to happen globally, and it's in a sense no surprise to hear that that's what's going to happen in Africa too, in your view. I guess the question is then, do you think there are lessons that can be learned from this global tragedy? I mean, do you think, for example, that, which is something I've wondered about, that international agencies ought to be, or ought to offer differentiated advice for different regions? I mean, something that struck me when this began was I looked at the World Health Organization's website, and I couldn't tell what I would do if I were a leader in South America or in Africa or in India. I couldn't tell how I would implement things differently from how I would if I were a leader in Europe. So, do you think that there are things that the world can learn, and that Malawi and Africa and other regions can learn from this, what is really a global situation?
Yeah, but I believe that what we can learn as Africa, but I think globally what we can learn is to take heed of advice when it is given, particularly by experts. Because as you rightly said in your introduction, we were warned in 2015, 2016 that this was going to happen. How it was going to happen, we didn't know, but we could have built the capacity to take this head on. Number two, the lesson that I think as Africa we should learn is that we must learn from now onwards to have homegrown solutions to problems like this. Because as you look at the problems and the way coronavirus has affected Africa, it's completely different from the West. So we cannot copy and paste. We cannot see what is happening in Italy, how they are fighting coronavirus, and adopt those as measures for Africa. Africa must come out with its own. And we must begin to learn to appreciate ourselves and our initiatives. Senegal has invented a testing kit that costs less than $1. Why is Africa not rushing to Senegal to make sure that they purchase those and make sure that everybody is protected, everybody is tested? Because that's what we need. That's what we need. So, but my big lesson from this is that one, we must be prepared because the viruses will come, pandemics will come again and again. We have now learned. Number two, but the lesson that I'll draw from this is that Africa must unite as 54 countries under African Union and have its own solutions for pandemics or any other challenges such as this. Why? Because our own inventions can save us in times like this, like I was talking about Senegal. And we must not undermine what has happened in Madagascar. What we should be saying is all running around Madagascar to say, do further tests to make sure that it can be a cure for coronavirus. We must also, Nigeria has also announced yesterday, I was watching on the news, somebody has come up with a concoction that they are calling a cure. So what I am saying is that we must not undermine our own inventions. We must not undermine our own researchers and scientists, and we must ensure that we have our own homegrown solutions for problems such as this. We must also understand that while we are looking at this pandemic, coronavirus, from January to April, 2+ million people globally died of cancer in the same period. I'm just talking about comparing the figures that are coming out so that we don't lose sight of the other illnesses that we have had for so long that now may be losing our attention, and then we'll come back with serious repercussions later on. I mean, 10 million women between January and December globally will die of abortion. And 240,000 plus will die of malaria. So when we have 229 people dying of coronavirus in the same period, we must learn from this pandemic that there are other diseases that are equally important and that Africa must pay attention.
Thank you very much. Professor Joseka is the former state epidemiologist for Sweden, and he currently serves on advisory bodies for both Sweden and the World Health Organization. He's been notable for his lucid and pithy questioning of some lockdown strategies, and particularly for posing what I think of as the Swedish question, namely, what will you do after lockdown? Professor Jacek, in 1995, if I'm not mistaken, you wrote, "The battle against infectious diseases must be fought again and again." Unfortunately, I couldn't read more than that because the paper is in Swedish, which I don't have, but it does look like you were right. So I want to start actually by asking you, if I may, do you think there will be a post-COVID world?
Yes, there will be, but it may be quite different from the world we see now in many respects. Could I just tack on from the previous speaker? I think that a lockdown is a disaster anywhere, but in the rich countries, it's mainly an economic disaster. In the low and middle income countries, many countries in Africa, it's a disaster. And the group, the advisory group that I'm a member of that works with WHO, we wrote a letter yesterday, no, the day before yesterday, to the Director General saying that any kind of hard lockdown in a low and middle income country must be stopped. The WHO must say that they never advise that, and that they advise countries not to take any measures that would destroy the social and economic, rather weak fabric of these countries. And I think that's what the previous speaker said also.
Can I ask about that? I don't want to put you in a difficult position vis-a-vis the organization you advise, but as I said, I mean, the way I actually got excited about this in the first place, I'm not a particularly activisty type person, but I was just very surprised to see that there was no specific advice for any different region. When in fact, when social distancing was being advised, the question that occurred to me is, well, what do you do if you are, living in a township or something, or in a slum in India? And do you? And I think that still remains, as far as I can tell, the case, at least from the Central World Health Organization. I wonder if you have any insight you can share into why that might be the case, or looking more forward, any sense of how the World Health Organization and similar agencies might have to change in the future in order to correct that.
Well, what our little group said was that the Central World Health Organization hates giving different kinds of advice to different countries. But I think this is one occasion where that should have been done. They should not have had this blanket advice to everyone, but adjusted it more. And I think that's what we heard from the previous speaker also. Adjust each country, not each country, but to different countries. But I think the World Health Organization loathes that, to have divided the world into different countries.
Yes, I can understand there might be a political element there.
Would be.
May I ask, so you've expressed the view that outcome from a health perspective, or at least, from the perspective of COVID-19 deaths, will be probably broadly the same in different countries within a broad spectrum of restriction or lockdown or mitigation measures. And there are somewhat similar views expressed by Professor Michael Levitt. It's slightly different, but somewhat similar. Of course, the economic outcome will be very different. So the question that's been interesting for me is how, if one is a leader in this situation, one is supposed to make that weighing up, given that the data that gets thrown around and the predictions that get thrown around are so different. So, I mean, I see constant Twitter wars about what is in fact going to happen in America. Has Italy, reached the peak or not? What's going to happen in Wuhan? And now they're unlocking. How do you think somebody who is in the position of trying to make a policy decision should assess these different claims?
Well, one thing that I think politicians, at least in the rich world, have missed completely is they've instituted different restrictions for the lockdown. But one is they didn't think very much about the effects of these lockdowns, and two, which is even worse, they never thought about the exit strategy. I can't think of any single country in Europe that gave a thought to how do we get out of this at the other end. Now they're all doing that in different ways in different countries, but it's very unplanned and not should have been thought about when you instituted the measures.
Yes, I mean, that is quite remarkable. Do you think, though, that, I mean, in the UK, it did seem to be there was a remarkable sort of U-turn when a report was released from Imperial College London, which implies that the government, believed in some sense that report. Obviously, that was not the only scientific opinion on the matter. There were other scientific opinions around, but for some reason that one held sway, and presumably it scared people so much that they didn't think about the outcome, which I agree with you isn't rational, but that may well be what happened. In that situation, then, is there a way that the leadership of the UK, for example, should have proceeded? So they should have chosen a different group of experts. I mean, how can somebody who is not an expert but does lead a country decide whether to trust, for example, the models that have been put out by the Imperial Group or Professor Jeseka, who is advising Sweden, for example?
I think the duty of a politician is to make wise decisions and not listen too much to what the population is thinking right now, but to think a bit more far-sighted. And that was missing. That was almost a race to the bottom among European governments to say, well, country X is doing this, so why shouldn't we do it also? And of course, the media were pressing that as well for them. So it's easy to be, with hindsight, it's easy. I don't think it was an easy decision, but I think many politicians failed in what I see as their duty. You shouldn't just ask one publication for advice. They could have given a few more days to think about it before they made the U-turn. But I shouldn't be criticizing the British government. I'm just saying that we're talking about them now, but there are others.
No, of course. And I share your view that it's very difficult to be a leader in that situation. I mean, I also share your view that the press have something to answer for. I mean, I have frequently heard the phrase, the death toll continues to rise, which is rather silly because one would hardly expect it to fall. It's only being said for dramatic effect. Can I ask then a question about epidemiology as a discipline, which is sort of shot to the limelight? I wonder, do you think that epidemiology will change as a result of this episode? And do you think it will be seen as the, sort of a moment of glory for the discipline, or as a sort of the equivalent of the 2008 financial crisis for economics, where advice was being offered that was one-sided, or that was not as helpful as it could have been? Or will it be something different again? Do you have any ideas about how the discipline is going to react going forward?
I think the trust in modeling will decrease with this. Modeling is very impressive because you use mathematics and difficult formula that no one understands. But when you look at the basic assumptions in most models, these are easy to understand and easy to discuss. That's seldom being done, actually.
Yeah.
A good comparison would be the economic forecasts. What will happen to the stock market next month? Should I invest or should I not invest? So if we really believed in models, we'd all be millionaires now, wouldn't we? With very similar models to the one that are used in epidemiology. Can I make one comparison? I think this epidemic has many similarities to the 1957 Asian flu, which in my country killed about 4,000 people. We'll go a bit above that with COVID, but not much. There was not a single school closed in the world. There were no restrictions on traveling. It was about the same severity as what we're seeing right now. But there was no thought about trying to stop the epidemic. This was an influenza. It was a severe influenza. We have influenzas, let it pass. So I think that's a good comparison to use here.
That's interesting. Okay, I think we might return to that point as well, about whether attitude to sort of sanguine attitude to a death and to infectious disease has changed over the years. Let me now move on to the third speaker, Professor Siham Khan. Professor Siham Khan is a microbiologist and an executive dean at the University of Johannesburg, and if I may say so, a pleasure to work with, as I've had the pleasure of doing for some years. Professor Khan, you are, I think, perfectly placed to understand the interface between the health implications of this pandemic and higher education and its implications for higher education. So I wanted to explore some of those issues with you, if I may, as well as some of the things we've discussed previously. So can we perhaps jump right in with asking how you think the university, any university, but you can take UJ if you want, will look a year from now?
Okay. I think any university, but in particular UJ, will look very different. I think I agree with the previous speakers that we are going to have to get used to a new normal. And I'm going to unpack that a little bit. And I'm going to talk about higher education on a whole, but I'm going to first talk about UJ. I think the greatest impact for us now has been, or the greatest outcome or objective has been, finish the academic year, salvage the academic year. And from that perspective, we've had to implement many strategies, many plans, think about resources and finance, and the best way to use that to reach the ultimate outcome. But I think we understand that within South Africa, the playing field is definitely not equal or fair within higher education. And so from a UJ perspective, I think you and I can speak and say, UJ has done well. They've done relatively well with regard to data and devices and the training and the plans and everything they've done. But there are institutions within South Africa that are still waiting. They are on pause. They do not have the strategies. They do not have the resources. They do not have the finance. And so from my perspective, when we look at higher education on a whole and how this has impacted us, I think it's not equal and it's not the same. And I think if I look at everyone, I say that there are pockets that are doing well, and that's based on historically their finance and their resources. And then there are pockets that are just on pause, waiting for help from government so that they can implement what the others have done. And so for them, the catch up is going to be delayed because from a UJ perspective, we're talking about, can we salvage the academic year by completing end of January next year, maybe a little bit into February? Or what can we do to have 2020 complete as close as possible to 2020? But there are many higher education institutions in South Africa that haven't even started with their online or emergency remote learning that are waiting. And so for them, the catch up and the implication and the impact will be a delayed one. And so for them, it might be like DHET sometimes says, and they have said in the week, and they've said, I think in some conversations prior, it might be that 2020 ends in April 2021. And so I think from our perspective, it's the catch up and the impact is not the same. And I think I'm of the opinion that we are fortunate working at UJ, and our students are fortunate in that perspective because they've registered at an academic institution that was able to provide that for them and the resources. But there are others that are just waiting. And it burdens me to say this, but I recognize that earlier on you said this is a safe space and we can say what we need to say. It burdens me to say this, but the outcome for the student currently is really dependent on what university have I chosen to register at. And that will determine what the impact of this shutdown, lockdown, and coronavirus COVID-19 will be on my studies.
Just for listeners, DHET is short for the Department of Higher Education and Training. It's also known sometimes as DOHET, after Homer Simpson's famous phrase. So I want to ask you a little bit about schools and basic education. I mean, the evidence seems to be that I've seen that's accumulating seems to be that really closing schools doesn't have a large effect on this pandemic, and students are not, children don't seem to be super spreaders as was feared. I don't know if you have a view on that, but what I was going to ask was that, I mean, obviously there's a knock-on effect, because if you trim a curriculum, then you get people coming into universities who actually just don't know as much as they did. Do you have any sense of how that's going to affect the university system in South Africa, perhaps more broadly as well?
I think from just a sense of completion, and then I'll speak from a sense of outcomes and what it'll be like to have that type of student coming into our system. There's been talk of obviously the grade 12 ending later in January. So of course there'll be a delayed reaction with the uptake of those students within the higher education institution. And I think that's a further impact that we must consider within higher education. It's not going to be 6 months, 12 months down the line and we'll all be back to our previous life and our previous normal. It's going to have a knock-on effect for a good few years, and that's important to know. It's going to have a knock-on effect in January 2021, 2022, whatever the case may be, that we'll go through this coronavirus and the aftermath of a lockdown that we've been experiencing. But if we are going to trim, I'll speak from our perspective. In health sciences, we were thinking of clinical practice, and we were thinking we need to find a way to train our students so that they are competent coming out with a profession, with a degree. And so can we look at clinical practice and trim something? And the question was, what? What must we trim? Everything that was regulated as an outcome for a student to know, I have to believe there was a thought process that went into that. There was thinking behind outcome A to Z was required. Trimming F and M has a consequence, because I'm hoping a thought process was, we need F and we need M. And so it's going to be, I foresee, if we're going to trim in any way, shape or form, we as a higher education institution is going to have to fill that gap. Recognize the gap, identify it, and then have to fill that gap.
I want to ask as well, I mean, on that basis, if universities are cutting various services and offerings, if they are no longer, for example, having students come onto the campuses, they're not offering in-person lectures, you know, the question may be asked just more generally, well, do universities need those things? Do students even need those things? And as you say, if something can be trimmed, the question might be why it was ever there. So, I mean, I wonder whether you think that is going to have an impact on the higher education sector in general, perhaps schools in general, I don't know. But, you know, is there a value in the interactions that form part of university education and in the fairly enormous cost of sustaining enormous infrastructures, dare I say it, huge numbers of staff? If it turns out that actually you can get, you know, maybe 85% of the education across without those things.
Yeah, I must admit, from my perspective, Alex, it does depend on the qualification and maybe what you are completing and what you are studying. I think more qualifications lend itself to an online mode. And as you know, we are offering some qualifications totally remotely. And that means 100% online, because it lends itself to that. And it's been structured in such a way that it can be offered. But I'm again going to bring it back to health sciences and maybe the science domain, where we have practical-based experience that is required, where we have simulation, where we have to ensure that students are experienced enough to interact with the patient, where we teach them interprofessional education. It's a matter of an emergency care provider knowing how to relate to a nurse, knowing how to relate to a doctor and a radiographer. And nothing teaches reality like reality. You cannot mimic patient care. You cannot mimic patient interaction. You cannot mimic the weird and wonderful things that happen in an emergency ward on a Friday evening in the middle of Johannesburg. There's just no simulation that will give you that live experience than the live experience. And so from our perspective, there are certain aspects definitely that we are doing well and covering via emergency remote learning. And then there are others that we simply cannot. We cannot teach it via that mode.
Yes.
Yeah.
Well, thank you. Thank you very much. I think we shall now move to the panel discussion. So the question is what the role of the AU is or should be in the efforts against COVID-19 and I suppose against future pandemics, given the different strategies deployed by different countries on the continent. I don't actually know if the AU has said anything about what should be done, which I don't know if that's just they haven't got coverage or if they haven't been vocal. Dr. Banda, do you have any views on the role of the AU, the African Union?
Yes, the African Union chair issued a statement, but a statement earlier on, I think 2-3 months ago, that just alerted all African countries to pay attention to the pandemic and to the rising numbers of people affected and infected, and to take action. But that's about it. If you ask me what should the African Union do, I think there's more that the African Union can do. Now that we know that pandemics will come and go, there's also one thing that we have found is that Africa is very good at dealing with pandemic, because we learned from Ebola, and now we are learning now. And I mean, I don't want to say much before we go through the plateau and to the other end, but I think so far most African countries have managed, and the figures show are remaining lower than other parts of the world. My view is that since we have an expert on this panel, I wanted to ask a question whether does he think that it is necessary for further research to take place in Africa, because there's something we can learn from here. Why is it that the figures haven't accelerated and gone up as high as other parts of the world, even those countries where the pandemic got into those countries at the same time? There must be something that we can learn from Africa. Some people can tell us, because the whole world can benefit. But African Union, therefore, must also ensure that they're mobilizing African countries to have their own scientists and experts do our own research into African situations. And we must also ensure that the African Union mobilizes our scientists and our inventors and all those that are coming up with ideas that we are all laughing at. It breaks my heart that we don't seem to take those countries seriously that are coming up with new innovations and new ideas, new concoctions. Whatever we think, it is very important that the African Union should take the lead, mobilize those countries that are coming up with the test kits, that are coming up with the herbal drinks, that are coming, because at the end of the day, those might help. And those may be helping already now, because our figures are remaining low.
Professor Giseka, can I throw that over to you? I mean, I don't know, do you have a sense of why, apart from arriving late, the figures in Africa are so extremely low? And also, if I may tack something on, I mean, I've heard people saying that the lessons from Ebola were not learned. It's certainly the case that Africa has a lot more contemporary experience with infectious disease than Europe, America, perhaps to some extent Asia. Do you think there are lessons that could be exported from Africa?
Yes, I think there are. Although I feel that Ebola is very different from what we're seeing right now.
Yeah.
It's a deadly disease that is not so easily transmitted and is rather restricted geographically, whereas COVID is a disease that usually doesn't kill you. The difference is that if you get Ebola, you're most often dead. If you get COVID, you're most often alive afterwards. So that parallel, I'm not sure how useful it is actually, between, because they're quite different. But I agree that there must be experiences from Africa that other countries could benefit from learning. But then they must be collected and presented in a way that will make the rest of the world understand, not sort of anecdotes from what's happened in this country or what happened in that country, but in a proper scientific way presented. But I think there are things to learn, yes.
Good, okay. I wonder if I could tackle something I was wondering about there, which might be of interest to all of you, which was whether I mean, it seems to me, again, the answer may be fairly obvious, but whether the fact this is a disease that affects the developed world is a factor in the reaction. I mean, in some sense, it obviously is. 5 million children under 5 die every year globally. According to UNICEF, we don't go into lockdown about that. But I mean, something that may have happened is that we may have thought we were past infectious disease in the developed world, and it suddenly turns out we're not. I mean, just in terms of the psychology of this situation, do you think that might be a factor? And it relates again to the possibility that a context like Africa, where infectious disease is the norm, might actually offer a model for a more rational response. Would anybody like to take that question?
I could do that. When you say you suddenly learned, I wouldn't agree. I mean, this is the fourth pandemic in my professional life. Started with AIDS, and then everyone said, "Ooh, infectious disease still exists. We must learn something from this." I'm not sure we did. Then the next one was SARS, which was very similar to this one, and I'm not sure we learned so much from that either. And then there was the swine flu in 2009, and then we have this. I think the world quickly forgets, and I'm quite convinced that 10 years from now, any effects on infection control from this outbreak will have been forgotten.
That's interesting. So we don't think this will make a difference, because a lot of people are saying the world will never be the same. What do we think about that, the other panelists?
Yeah. If I may, I see a question, and I'm just going to incorporate that question now here as well. I think some of us have mentioned what we call the new normal, and that new normal will be around for, I think, till the vaccine is found, or whatever the case may be. And I think people will remember this, and I agree with you, the human memory is shockingly short. We forget very quickly, and we tend to move on when we're in a different situation. But I think for a short while, there'll be reminders for us, and those reminders will be the social distancing. Those reminders will be the fact that we may not probably shake hands as easily as we have before. We'll probably not hug as frequently as we did before. But I think what is important is that we begin practicing that new normal as soon as possible. I think from our perspective, if you want people to remember and to react in a certain way and it be part of their inherent behavior, they need to practice that behavior. And so if we are advocating certain ways that people will change behavior, they need to practice that behavior. And we cannot practice that behavior, unfortunately, in a lockdown situation. I do not shake hands often living alone, and I don't certainly hug myself daily. But I need to understand what that normal will look like by going back to some sort of reality. And so I think that normal we speak about is just mindful of certain things that may make us more susceptible to the SARS-CoV-2. And that is what we talk about when we say new normal, the inherent things that we'll do to offer us some sort of protection against infection of the virus.
Well, maybe in the new normal we will be all hugging ourselves daily. Can I ask, somebody has asked here, which I thought was quite interesting, would you say that one of the things we'll learn or consider is the subjectivity of when to declare a pandemic? So, and I know there is a sort of a definition of when to declare a pandemic. Do we think that there is an element of subjectivity there, and is that likely to be changed going forward? Is there going to be a more objective standard for that?
I think, and I'm obviously going to lean towards Professor Giseka as well, who's the immunologist. But I think this global pandemic, when it was announced that it's a pandemic, I think many people think that it was because of the infectivity level of the virus, not understanding that it was because of the geographical distribution, more than one place, and the fact the number of people it was actually infecting. And it really was nothing to do with how lethal the virus was, but more where the virus was found and the geographical distribution and the rate of transmission. And I think that was important to understand, and people still seem to have a synonym that says global pandemic relates to lethal virus. And I think it was said before, many of us will be infected, and many of us because of our immune system and the way we react and the way we live, we'll live after the virus. We'll go on living after the virus. So a pandemic seems to have inherently incited a fear in people saying, this is serious. And the pandemic, I think, was announced because of geographical distribution, the fact that it had spread and that many people were being infected, and did not directly link to the virus is lethal and you will die if you contract this virus. That cannot be how it was. I think it's not a synonym. Those two cannot be compared.
Professor Yuseka, I saw a thumbs up appearing on your screen. Did you want to comment, or are you simply approving?
No. I like that bit about the geography and the special sociology of the place, and that we overestimated the lethality of the disease. That's why I gave a thumb up.
Excellent. Dr. Band, I think this one is for you. I have a question here. Let me just put it up. On whether, based on the panel's understanding of African economies, which sectors do we need to prioritize reopening to minimize socioeconomic hardships while ensuring the infection rates are managed? Do you have a sense of, clearly in a place like Malawi, and in my view also in a place like South Africa, a full lockdown isn't feasible, but clearly maybe some things can be changed and some things not. Do you have a sense of which bits are the most important to fire up first, and which might be held back a bit more?
Yeah, you mean businesses?
Yeah, I mean, should it be education that gets going first, or should it be tourism?
I think for me, I think it's agribusiness first. I feel that everybody will want to eat. And so the little they have will go towards food. But food has to be produced. So if the countries have the capacity to support their citizens, it should be in the agricultural sector, so that people in the agribusiness can move food up at the chain, and so that people have enough food. And in Malawi, if we experience hunger, I was looking at my statistics when I was doing my research today. Between January and April, 2.8 million people worldwide have died of hunger. So, and that is not as a result of coronavirus. It is going to get worse post-coronavirus, because in East Africa, there's been locusts, and then people have not grown, and then we have floods. So if there's an area that I think we needed to prioritize as Africa, it is food production. And I have been speaking to the African Development Bank. I had a meeting with Dr. Ndesina even before coronavirus about increasing food, cash crops, the production of cash crops in Africa. I think we need to intensify agricultural production and the agribusiness.
I think we have time for one more question, and I am not sure who wants to answer this. It may be too political for some of you. The question is a slightly enigmatic one. It was, how can we prevent the World Health Organization from being influenced by states like China? You can interpret like China however you wish. And perhaps you don't think we should prevent states like China from influencing the World Health Organization. Does anybody have a view they want to share on that? Perhaps Professor Yuseka, you commented before on the democracy, on the role of political systems and of democracy in deciding on measures to combat the pandemic.
Well, I'm afraid I've written that also, that the political ramifications in some countries of this pandemic is, to me, the worst or the most dangerous outcome of what we're seeing now. That strong men and strong women in countries would seize this opportunity to grab more power for the future. But to answer the question about WHO, I think one good way is to bring the USA into the funding crowd again. Because this is evidently a competition between two great powers. The US pulling out and the Chinese moving in, and that needs to be I mean, the Chinese, I shouldn't talk, but they're doing a lot of good things and they're doing good research, but they become dominant in a way in the World Health Organization, which I'm not sure is beneficial in the long run. Over.
Yes. Thank you. Does either of the other panelists want to comment?
It's a difficult one.
Don't have to, it's fine.
I tend to agree. Nothing is healthier than, I think, having more than one opinion and more than one influence. And when you tend to give that power and influence to one individual who holds the pocket strings, then of course you're going to lean towards that opinion as being your major influence. So I think when you have more than one, it does give some healthy competition and more views. And then I tend to agree, bring in more people than one that holds all the pocket strings that will inevitably steer you in a particular direction.
Well, thank you. I want to thank all of my panel. I think that was extremely interesting for me. I hope it was interesting for the listeners and the viewers. The new normal in academic events shall be that we start and we finish on time, which is not how these things normally work in person. But because it is possible to mute participants forcefully, that we can do this, which is, I think, an interesting development for the academic world and perhaps the most significant ramification for the higher education sector.
That's the new normal.
That's the new normal, agreed.
That's the new normal. You can shut people up without actually having to say anything to them at all. Well, thank you all very much. I really enjoyed that. Next week, for those who are interested, we'll be having another such event. I will confirm the time through the same channels. We are hoping to have the Deputy Finance Minister of South Africa here, David Masondo, as well as the former advisor to Barack Obama, on the former Africa advisor to Barack Obama, Grant Harris. I will confirm all those details in due course, but I very much hope that everyone who was listening and watching may join us. And thank you once again to my panel for a wonderful kickoff to this series. Thank you.
The University of Johannesburg, the future reimagined.